My name is Dr. Jim Partridge. I'm a physical therapist with Allegheny Chesapeake Physical Therapy. It's actually physical therapy applied to an aquatic environment. It's not just exercise in the water. It's really a totally different environment, and it has a number of different benefits that you don't get with land therapy. Probably the biggest one would be the effect of buoyancy. Buoyancy is the upward push of the water, but that buoyancy works against the effect of gravity on our body. The effect of gravity on our bodies is what leads people to have a lot of pain and problems with their, especially weight-bearing joints like their knees or their hips, because in the water, that gravity is minimized. And that can have tremendous effects on comfort, for one thing. People will have their joints unloaded, and if they're having pain in their back or their knee or their hip, that pain will be sometimes eliminated. Another effect of buoyancy is it actually supports your limbs or your arms and legs so that it makes movement much more fluid. In our practice with Allegheny Chesapeake, the primary conditions that I'm seeing are orthopedic conditions that involve, as I just mentioned, the weight-bearing joints, hip and knee problems, low back problems, but any condition that involves difficulty with weight-bearing activity. That's a condition that's ideally treated in the water. If people have certain neurological conditions such as stroke or cerebral palsy, multiple sclerosis, I see a lot of people in the water with arthritic problems, and their pain is offset by the effect of the water, their movement is better, and they can exercise in a lot gentler way than on land. Another huge concern that people have is just fear of the water, or the fact if they've not been in the water for years. I've had many patients who have said, I can't tell you how many years, I can't remember the last time I was in a pool. And probably the biggest concern that people have is they associate aquatic therapy with having to be able to swim. But you don't have to be able to swim to do aquatic therapy.
My reaction was I'm absolutely and positively terrified of water. I had not learned to swim as a child, and I had a mother who didn't swim who scared me. Told Jim, and he was so reassuring about the fact that he would be with me, that we would stay in the shallow, that if we needed to go deeper, he would show me exactly where I could stop walking and still be above my head. And I decided to try. I realized that from what I've experienced trying to do exercises on equipment or walking, that there's a lot of stress. I can feel the impact of a sidewalk or even a carpet. And I thought about it and realized that even though I was insecure, if I put on water shoes, I wouldn't be afraid of the bottom of the pool, and that the buoyancy might actually be the benefit he was describing to me. The ability to use my hips and move forward, not feel the same amount of pressure on my left side where I have nerve damage. And I felt as though this really could be something special in terms of a transition away from trying to use equipment that was too challenging. And not to feel out of control as I did on some of the exercise equipment, just sort of felt more in control in the water, even though I was very frightened the first time I went in. By the end of my session, though, I couldn't believe, I was exhilarated because I felt so much ability in terms of my balance, my hips. I felt almost like I was a teenager again because I could lift my leg in the water so much higher than I could lift it anywhere else since I was a kid. I could even do cardio in the water. And getting to a cardio level for me is very difficult. In the water, my hands don't get sore holding on to a handle because the water gives me the buoyancy. The time I spent in the water with Jim and with some of his wonderful aides like Melissa, they kept me confident not only about the PT, but they also gave me the confidence to wear a buoyancy belt and go into deep water that was clearly the deepest I'd ever been in. And I decided to ask if the club's swimming instructor was able to deal with someone like me.
Who went from literally having me escort her in and out of the water every time to now taking swimming lessons, and I'm extremely proud of her.
And I even was delighted that Jim was so encouraging that after my first swim lesson, he was kind enough to send me this note. Deb, I talked with Jamie after your lesson on Tuesday, and she said you did great. I am so proud of you. Keep up the good work and get that hubby over to Club 1. Take good care, Jim. And Allegheny Chesapeake Physical Therapy did make me feel like $1,000,000.